progesterone in preterm birth prevention and treatment. Let us look at what is the role of progesterone in prevention and treatment of preterm births. Now, after a near lull of over 15 years, in 2003, there was a publication which spoke about using 17-OHPC for prevention of preterm births. And this was then followed up by many such publications where natural micronized progesterone was also used to prevent preterm births. Now, what is the proposition and how can progesterone help in bringing about reduction or prevention of preterm labor? Now, it has been found that progesterone has various mechanisms of actions, and the ones which have been identified are at 4 important sites. At the site of the placenta, it is known to regulate the timing of labor via controlling stress hormone CRH. In the amniotic fluid, it is known to limit the prostaglandin production. At the fetal membranes, it blocks the pro-inflammatory cytokines, induced apoptosis and prevents PROM. And at the myometrium and the cervix, it is known to suppress inflammatory responses and prevent myometrial contractility. So, thus progesterone acts on the various mechanisms and thus brings about myometrial quiescence and thus helps in prevention of preterm birth. The progesterones which are available for us to use in situations are 17-OHPC, which can be given in the dose of 250 milligrams per week intramuscularly, starting from 16 weeks continued till 36 weeks of gestation. Micronized progesterone, which can be given orally in the form of a capsule given twice daily, 100 to 200 milligrams per day, or by using an oral sustained release formulation given once in a day in the dose of about 300 to 400 milligrams, or it can also be given as a transvaginal formulation placed inside the vagina, which is something which I do not really appreciate because of the alteration in the probiotic milieu inside the vagina. And of course, progesterone gel also has been studied. So, these are the various ways in which progesterone can be administered, either in those patients who have a historical risk factor of spontaneous preterm births, or the ones who have been identified to be at risk, or the ones who have been found to have a short cervix at the outside, or a gradual shortening of the cervix, or as maintenance tocolysis after acute tocolytic acts have been taken care of, and then for maintenance of myometrial quiescence, one can consider using natural micronized progesterone, 17-OHPC in various formulations to prevent preterm birth. The concerns, however, are: 1. Is it really effective? And this is something that we have to counsel our patient, that about 30 to 40% of reduction has been observed. It does not give a 100% result. That is one. This can be because various confounding factors must be coming into play. Secondly, when we are taking it in the form of an 17-OHPC injection, there is a theoretical risk of increased occurrence of cholestatic jaundice in these patients because of high dose of progesterone, but this has not been proved beyond doubt. So, these are the challenges, and plus taking tablets seems to be increasing better patient compliance.